Hey everyone, welcome to our first episode of Mind Shots by Mind Decoded. I'm Verghese Matthew.
And I'm Alan Alexander.
Hope you all are keeping safe. First of all, thank you so much for tuning in and showing us support. And before we address any questions on mental health, I think it is really important that we talk about the goals of this page. Alan, can you please start off by talking about the goals of this page?
The idea behind Mind Decoded involves two goals. One is awareness. Awareness is key to understanding mental health and mental illness, and the lack of this awareness leads to misconceptions and discrimination. It is human behavior to fear what we do not know about, and that puts people with mental health issues in an unfair environment and prevents them from getting help. We want our community to accept this and help develop a supportive environment for people with mental illness to achieve that positive mental health.
Okay.
The second goal behind this page is to help students of psychology and mental health to find clarity in choosing their line of professions and also find credible training. Although there may be more topics related to clinical and psychology and counseling, we will also cover other areas of psychology. We'll try to also bring professionals, postgrad students from different specializations to share their experience. So our posts will basically alternate between topics of mental health and academic interest for students of psychology.
Okay. Now let's try talking about the basics in mental health. I'm sure a lot of us would have heard a lot about mental health from various sources, but I think we have to start off with the basic question to set a common ground for everyone to be on the same page. Alan, why don't you talk about why mental health is actually important?
I keep hearing most of the time, people say mental health awareness is the need of the hour, but a slight change in that. I mean, at least from what I feel, it is the need of all ours, just like how we care about our physical health. Mental health is influenced by physiological, psychological, and social factors. And there is also evidence that a mental health disorder can impair one's self-care, interpersonal relations, occupational skills, and social relations. So now if you look into that, even poor self-care from a mental health disorder can, in terms of nutrition and hygiene, can lead to risks in having a physical illness or a condition. So it is important to balance and keep that check and give due attention to both mental health, just like how we take care of our physical health.
Okay, so then I think we should bring more clarity to this by telling what actually mental illness is. So what can you say about that?
A mental illness or a mental disorder refers to a wide range of mental health conditions that affect one's mood, thinking, and behavior. Now, people hear about these disorders. Most of them know about mood disorders or psychotic disorders, anxiety disorders, and even substance dependence. And among these problems, people keep mentioning mental or psychological problems. Now, these words, mental or psychological, are interchangeable terms used to relate to the human mind and emotion. But the catch here is to understand about the abnormality here. What causes the mental illness? In the abnormality in one's mood, thinking, and behavior. So I think, Matthew, I need you to elaborate on this abnormality.
Okay. So basically abnormality is an intense change in those factors you mentioned, that is the mood, thinking, or the behavior, which actually leads to an impairment in the personal, social, and occupational domains of an individual for a specific period of time. So now the nature of the change or the intensity and the duration that I had mentioned before actually differs across disorders and demographics. However, what we really need to keep in mind is the psychological problems are actually not, or let me put it in the right way, the mental illnesses are not always a disabling condition, and that can always be managed well with medication and therapy. We'll definitely be discussing about various mental health issues and illnesses in the upcoming episodes. But before that, certain questions keep popping into our mind. That is a mental health survey in 2016, which was done on a relatively small sample, showed that the prevalence of the mental, neurological, and substance use disorders in the population is roughly around 10.5%. Okay, but what we see that is that people are still not trying to come out with their mental health issues. Now, what do you think it makes it are the factors which makes it difficult for the people to seek mental health services?
And now the idea behind all this again is just what we are trying to tackle over here: the lack of acceptance and stigma. I feel that is one of the most important reasons for why people find it difficult to approach mental health services. We have heard from our elders that a mental illness, used to be signs of the spirits of being cursed. We've heard about people being chained in their homes and when they were, because they were dangerous. But now, as times have changed, we've been able to understand that these reasons behind these illnesses were basically due to factors such as, some biological risks, maybe a troubled childhood or upbringing, and also maybe a hostile social environment where the person grew up. Then there may not be a single cut reason. However, the misconceptions persist where people are not being brought to level on what we have learned. So this lack of awareness creates stereotypes like those mentioned, and that lead people to act with prejudice and discriminate individuals with mental health issues. They prevent individuals from living a life with dignity and living in a fair environment. This again brings a fear of shame for families, and they would rather hide the person with illness rather than address the matter. This again prevents the person with illness from approaching mental health services. Now, there is an acceptance for people who live with conditions such as diabetes or hypertension to lead lives with adequate treatment and supervision so that the condition does not disable them from living a productive life. Similarly, we need the same acceptance for people who live with a mental health disorder to lead lives with adequate supervision and treatment so that they also can live a productive life as much as possible. Okay, and I think with this whole discussion, I think we'll wind up this episode by discussing who are the different kind of mental health professionals we can find in a clinical and a non-clinical setting. Matthew, can you start with it?
Yeah, sure. So generally in a clinical setup, we have 4 kinds of mental health professionals. So we have a psychiatrist, we have a clinical psychologist, we have a psychiatric social worker, and a psychiatric nurse. Now, a psychiatrist is a person with an MBBS degree and then further goes to take up an MD degree in psychiatry or a DPM degree with clinical training. Now, they get extensive training in the diagnosis and treating clients with medications. Now, they also require to have a license from the State Medical Council to practice in whichever area they are in. A clinical psychologist, on the other hand, is a professional who has a UG psychology, which is for 3 years, and a PG in psychology or applied psychology, which is another 2 years, and then another 2 more years in MPhil clinical psychology. And they are also extensively trained in, the assessment, diagnosis, and interventions by, psychotherapy. Now, a clinical psychologist is also required to have a license by the Rehabilitation Council of India to practice.
Okay. Now, let's come to a psychiatric social worker. Now, you would have already heard that, a psychiatrist and a clinical psychology, they work with a patient. And from what you hear, most of their interventions and their assessments happen inside the hospital. And now, who works outside the hospital for these patients? That is a psychiatric social worker. A psychiatric social worker has to complete 2 years of Masters in Social Work and 2 years of MPhil Psychiatric Social Work with clinical training. And he or she is trained to assess the psychosocial dynamics of the family, their work environment, their social environment, and their support systems. Identify the setbacks or mistakes there, the issues there, and treat the patients. Now, treating these patients can be through maybe behavioral and therapy interventions, but also by facilitating and helping them identify sources of support. Now, these can be, finding welfare schemes, financial aid, employment opportunities, community aid, etc. Whatever that can help, the patient to achieve recovery from the help of their social environment. And lastly, we have a psychiatric nurse who is a professional with a diploma or degree in psychiatric nursing. Now, a psychiatric nurse is equipped to handle patients with psychiatric illnesses and administer their medications and also supervise their general health needs. A psychiatric nurse is also required to be licensed by the State Nursing Council in their region of work. Other than this, when we look outside the hospital settings, we have counseling psychologists. Counseling psychologist is a professional with 2 years of masters in counseling psychology, with training on counseling skills and techniques to work with individuals on daily life stressors and life events. Yeah.
Okay. Thank you so much, Alan. So I think with that, we'll wind up today's episode. Thank you so much for listening. And we really hope that this has helped you in understanding mental health and mental health professionals. Please do comment if you have more questions regarding this.
Write to us your feedback and inputs in the comments. Also, share this with who you feel will find this helpful. Once again, we appreciate you guys for listening and stay safe.